Welcome back to Plastic Surgery Decoded, the podcast where we demystify plastic surgery and provide a foundation for understanding it, whether you're actually considering a procedure or you're just curious. As always, I'm your host, Dr. Regina Nouhan, and in this season number 4, you'll find a new approach, including interviews and covering a wide variety of subjects. But after you listen to this episode, I encourage you to go back and really explore the previous seasons, as they are full of valuable information. You get to pick and choose what to learn about next. Season 1 covers common aesthetic or cosmetic surgery topics and skincare, while Season 2 explains reconstructive surgery topics. Then Season 3 goes over general questions about plastic surgery. Remember that this podcast reflects my experience and opinion, as well as those of any guest interviewed. It is not intended to provide medical advice, nor is it a substitute for a formal consultation with your physician. So stay tuned for this interesting journey we'll take together in the ever-expanding world of plastic surgery. Let's go! People who are undergoing elective surgery, or really any surgery, are often focused on the essentials of the procedure itself, such as whether or not they're good candidates, what the outcome will be like, whether or not they will have much pain, how long it will take for them to get back to daily activities, and what the scar might look like. I think it's fair to say that they're rarely very concerned about what they're eating and drinking in the weeks before surgery and then afterwards. Yet it's remarkable how much of an impact proper perioperative nutrition can have on a procedure. The word perioperative referring to the time before and after surgeries. The truth is, it can have significant influence on the whole experience. So in this episode, we're really diving into this topic with a panel that includes a registered dietitian who focuses on nutrition needed for plastic surgery procedures, as well as a plastic surgeon in private practice who recognizes how instrumental perioperative nutrition can be in facilitating best results. As you listen, you'll learn about the goals of good perioperative nutrition, such as reducing inflammation, accelerating healing, and reducing the risk of infection, and that a focus on nutrition can help the body weather the trauma from surgery in general, or be in the best condition to handle it. And you'll also learn about some specific best foods and worst foods to consume around the time of surgery. You might be surprised by a few of these. So let's go to the conversation right now. So we're here today to talk about pearls of perioperative nutrition, and we're lucky to have Kylie Bensley with us, who is a registered dietitian specializing in plastic surgery. And we have Dr. Brian Arslanian, a plastic surgeon in private practice in Atlanta. Welcome, you both.
Thank you so much.
Thank you.
Glad you're here. I would love to hear from each of you about your current practice. Could you tell the listeners about what you do on a regular basis? Kylie, can you tell us about your current practice right now? And Brian, Dr. Arslanian, could you tell us what types of cases you typically do and what your practice makeup looks like? Kylie?
So I specialize in plastic surgery, and that really came from a background of surgery where I kind of went into counseling and coaching plastic surgery patients. So I still coach a little bit on the side for plastic surgery patients and their whole journey. And then I'm one of the founders of a plastic surgery nutrition company for women. And we have educational resources, supplements, and meal plans for women to carry them through the plastic surgery journey.
Great. Now, what about the men?
I really try to make it as unisex as possible, but it's because the way that I talk and just my feed and everything, I just say women, but we have men. We have men definitely who've used our products.
That's great. All right. And Dr. Arslanian?
So I'm located in Brookhaven, which is just outside the city limits of Atlanta. I've been here now for 9 years, I think I've been in practice. So my current practice is cosmetic and reconstructive surgery, probably about 60-40, 70-30, something like that. More cosmetic than reconstructive now. But in terms of what I actually do for the reconstructive side, I do a lot of breast reconstruction for breast cancer patients.
Nice.
Breast reductions. I do a fair amount of transgender surgery as well.
We just did an episode about that.
I listened to that episode, actually.
Yeah.
And then on the cosmetic side, I pretty much do everything, face, body, breast, injectables, all that. But I would say the majority of my practice is mostly more complex breast and body surgery. So a lot of, tummy tucks, mommy makeovers, breast lifts, implants. So a lot of my surgeries are 4 to 6 hours or something like that.
Yeah, it's a good bit of time.
So they're big surgeries, and that's part of the nutrition aspect. It comes into play a lot with these bigger surgeries.
Excellent. Well, now, how do you guys know each other?
Brian?
I guess I can give this spiel.
Yeah.
So I did a general surgery residency before plastic surgery. I did 5 years at one of the Harvard teaching hospitals in Boston. And there I met Kylie's husband, Rodney. We started together as interns. And through him, I eventually met Kylie. We all became kind of friends. My wife's a surgeon too, so the 4 of us all kind of got along and stuff.
That's so great.
And then I graduated, finished, and headed down to Atlanta to do my plastic surgery training. After we all started having kids, we decided to kind of reunite and get back together. So we have an annual camping tradition every year.
Fun. Oh my gosh, I love that. Well, I'm glad I have both of you here for this episode because we really want to get the point of view from a trained nutritionist and also a surgeon about this topic, which often really doesn't get the attention or focus that it probably deserves. So, Brian, Dr. Arslanian, I'm going to start with you. Are there misconceptions about the importance of perioperative nutrition? And just for the listeners, the word perioperative means, in this case, the time around a surgical procedure, so before and after. So what do you think about that?
Yeah, so I would say maybe not so much misconceptions, but more just kind of a lack of knowledge or maybe awareness of how important nutrition is. So I think the misconception might be that cosmetic surgery patients in general are just healthy, well-nourished individuals, and why are we even wasting our time with discussing this? But
for something purely elective.
Purely elective. These people are supposed to be very healthy coming in and everything, which in general they are compared to some of the other patients we deal with. But, the standard sort of American diet that most of us are on is probably nothing close to good nutrition, honestly. So I think even though we don't look at these patients and see them as like emaciated, malnourished type people, I think a lot of them are probably deficient in protein and vitamins. And I mean, most of our diet is pretty pro-inflammatory, I think. So I think, on the outside, they may not look all that unhealthy, but I think on the inside, there's a lot more that's going on.
So what kind of stress is the surgery putting on the body? So why does it matter how much protein you're taking in and, et cetera, et cetera?
Surgery in general all surgery is going to, as you know, going to put some stress on the body. Some of our procedures are pretty intense in terms of the amount of, surface area that we're operating on. So, whenever you operate on somebody, you're going to increase cortisol levels, the adrenaline, so people's heart rates, blood pressures, cardiac output, all that stuff gets increased. Insulin resistance goes up, and then because of that, you get increased blood sugar, which is a big problem in the post-operative period with healing and everything. And then, you have the whole acute inflammation process and the cascade, and all those things can lead to immunosuppressive issues. And then when you combine that with the hyperglycemia, then you run into problems with wound healing, infection, and then you also get the issues with post-inflammatory. The post-inflammatory state really is what propagates the whole blood clots and DVTs and pulmonary embolisms and that whole thing, which is a big issue. And
you need probably extra proper fuel, if you will, for wound healing from the surgery, I would imagine, too.
Oh, yeah, absolutely. Because I always tell patients you're in a, not that everyone knows what I mean, but, you're in a catabolic state at that point. Your body needs calories to rebuild itself. So, I mean, I have so many patients who, 2 days after surgery, they're talking about, can I start working out? Can I start, get on my semaglutide? Can I start dieting? And it's like, no, you have, your body's trying to rebuild itself right now. So,
yeah, take a beat.
Why are you deciding right now that this is when you should be trying to lose weight?
And you mentioned that you do a lot of longer surgical procedures. Do you think the magnitude of the surgery impacts the need for special nutrition around the time of surgery?
Yeah, absolutely. If you were to compare, let's say, I do a lot of smaller procedures like neck liposuction or like buccal fat removal, which is a popular thing lately.
From the cheek.
And I mean, some of those procedures might take 30 minutes, 45 minutes or something. Might be doing them under local or sedation. In those cases, I'm not really getting all that worked up about the patient's perioperative nutrition. It's like they're going to the dentist to have their wisdom teeth taken out sort of deal,
Okay,
right?
all right.
So, but on the other hand, I also do a lot of surgeries which are 6, 7, 8 hours long that are affecting 50 to 80% of their body surface area.
Yeah.
Like lipo, tummy tuck, breast lift, those kind of things.
Yeah.
And that definitely leads to, a massive inflammatory response, and there's a big recovery process that has to go into that.
On my end too, I always ask people what kind of surgery they're having, because oftentimes they go in and they think that they're just going to have like this supplement and they're going to be fine. But a lot of these mommy makeovers now are doing mommy makeover, tummy tuck, and a BBL.
Yeah.
Like I see that combo a lot
Big
now.
procedures, yeah.
I mean, that's major surgery. And most of these women think that they're going to bounce back in a couple weeks, that they just can do on shakes and bars, and they can go back to normal in a couple weeks. And I just say, you've got to put yourself out for, 3 to 6 weeks, just understanding that you're not dieting, you're resting, you're not getting busy, and that you are eating a high calorie diet, and then really trying to educate them that it's even dangerous to lose weight at this time. You will feel horrible.
Right.
Your wound can reopen, and sometimes when they say, oh, I just feel so terrible and I've been feeling terrible for weeks, the majority of that is because they've had these major surgeries and they're not eating enough. But they don't recognize it. They just think, oh, I've had this surgery. I'm like, no, you had the surgery, but you're just not eating hardly. You're eating maybe 1,400 calories,
Yeah.
And they just see it as like a normal response. And I said, this is not normal. It's your body telling you that you have to start eating more and drinking more.
Yeah. Well, where do people generally get their nutrition information?
I would say 2 big sources are Googling and Facebook groups. I would say Facebook groups are the number one way they're getting their information, from asking surgery sisters, what's the best to do? Why is this happening? How does this look? I don't like this result. I like this result. I've been in those groups and they're fascinating. Some of it's right.
Some of it's accurate.
Not all of it's wrong. It's just sometimes what I tell people is it's not wrong. It's just subpar. It's just not really great advice. It's just subpar advice, that's not really going to help them. It's not damaging, but it's not going to move their dial at all, when they heal.
Gotcha. Are there some general themes that you recognize on social media that are either misinformed or kind of need to be debunked?
When I'm on social media, I just try to think of, okay, what are my 4 or 5 main things I'm always trying to preach? Because if you can do that on social media and just drive those home, then people eventually pick those up,
Great.
The first one that is very common, I see this more on Facebook more than Instagram, because Facebook is more like a storytelling.
Oh, yeah.
But they tend to do fasting and detoxing right before surgery. In fact, I just received a Facebook DM in a Facebook group literally last week asking, why can't they detox? Why can't they fast before surgery? Because they're taught that they get better results if they fast before surgery.
Interesting.
And I don't mean doctor-led fasting.
Yeah.
We're talking detoxing.
Just word on the street.
That's the first thing. And then the second thing is, and it's not wrong, I just teach a lot that it's not all about protein. That's driven home is protein, which is so true. But what I also tell people is that the majority of what we are deficient in are micronutrients, and those are going to really help seal your incision and help your healing process. Vitamins, your B vitamins, right? Your minerals such as magnesium, copper, things that help with collagen production. So I say you've got to look at not just protein, but also your vitamins, your minerals, and then calories. So I'm always teaching calories, not just protein, because a lot of people are doing all their protein, but they're not hitting their calorie goals. And so they're just not feeling great after surgery.
Kind of like if they were dieting throughout their life and they're trying to focus on protein and lower the calories, they keep that mindset, and that can be detrimental to the healing, is what I'm hearing you say.
Huge. That's probably one of the biggest things I come against.
Okay.
Yeah, is the weight loss.
Got it.
Trying to lose weight.
And what's the third thing?
And this comes against a lot of people. I tell them that bruising is a vanity metric.
Oh, tell us more about that. Yeah.
And I say, we are not worried about bruising. Bruising takes your focus off of your main objective, which is to heal. And so we do not care about bruising. Bruising is a vanity metric. That's a little harsh, but I feel like it has to be a little harsh. And then I even go as far as saying, we're not going to be concerned with minor swelling. And I'm very cautious about that. I say, you need to talk to your doctor. Always ask your surgeon. But I say the two things I don't want you to be obsessed with are minor swelling and bruising. They're obsessed with looking at every part of their body. And Brian taught me this too, that they're staring at their bodies after surgery every single day.
Scrutinizing, yeah.
And so they're going to see every single change that goes on. And swelling bothers them and bruising bothers them. And so that's kind of something what I teach too is let's change our focus and focus on something that's really, truly going to move your dial.
Oh, I like that. Yeah. And I think that would register with a lot of people because deep down, that's really what they want to do anyway. So.
Right, yeah.
Well, let me ask both of you, what are the goals of good perioperative nutrition? We've talked about this a little bit, but what are we really trying to accomplish with even paying attention to the nutrition? Reducing inflammation or, what are your thoughts?
Some people have the idea that we want to eliminate inflammation after surgery, but I try to emphasize to people that we want to contain it, we want to reduce it and prevent it from sort of getting out of control. But, inflammation is a normal, necessary part of surgery and the recovery process. Without it, your body actually, won't heal. And I always tell people it's kind of like, since everyone knows about COVID, and I'm not saying I'm an expert in COVID, but, sort of at the beginning of the pandemic when everybody was getting really, really sick and in the hospital and the ICU and people are, dying and everything. It wasn't so much that it was the virus that was the problem. It was the over-the-top inflammatory response to the virus that, was putting people into ARDS and all these other things that were killing them essentially, right? So it was kind of like the body's launching a nuclear war when we just need to send over a couple fighter jets to solve the problem.
I like that analogy.
I kind of, on the side, I like to dabble in longevity medicine and all that kind of thing. And
interesting.
You see it in cardiovascular disease and diabetes, even some of the neurocognitive disorders and definitely autoimmune disorders where it's not so much that it's a high-fat diet or the sugary diets that are killing us. It's the side effects of chronic inflammation that's really leading to the atherosclerosis and all the other sort of things. So the first goal is we don't want to eliminate inflammation, but we just want to try to sort of curtail it and keep it under control. And then along with that, just support the immune system because, patients, you do have a somewhat suppressed immune system after surgery. You want to prevent infection and everything. And then a big thing that's been...
And nutrition helps with that.
And nutrition helps with that, absolutely. Kylie can get more into that. And then the last thing I would say is just controlling blood sugar and hyperglycemia. And again, because we know from the surgical literature that post-op hyperglycemia is a big factor in wound healing problems. So if we can use nutrition to... Obviously, we're not typically doing cosmetic surgery on uncontrolled type 2 diabetics, but even patients who are not diabetic get hyperglycemia after surgery because that's part of the inflammatory process, right? So
that's another, on a side note too, when he was talking about that, that's, what happens when you're fasting before surgery, how that increases your risk for insulin resistance after surgery. So that's why, in the hospitals, they tell you before surgery, they tell you to drink like a high carb drink before surgery. They have like the Ensure maltodextrin pre-op clear drinks. But that's kind of what I brought into the plastic surgery space is I tell women to drink apple juice the night before surgery. Some of the other hospitals do that for surgery. I think Duke does it. And so I tell them to do that also. But in my teaching after surgery, I teach them We're stopping the pineapple juice. Like, I know everybody wants to chug pineapple juice for bruising, but I say we are no longer chugging all this juice. We're drinking like a half a cup. I've been trying to teach them about beet and carrot juice instead, just to really minimize that risk for insulin resistance. And then there's also like a JAM article, just how blood sugar is one of the top 5 reasons how you can get infection in your incision. So
elevated blood sugar, yeah.
Yeah, so really teaching them to we stay away from the beautiful fruit bowls. We stay away from chugging the juices. And we just try to balance our blood sugar through basic pairing carbs and proteins to keep that blood sugar stable in the post-op.
Is there a certain ratio of protein to carbs that you look for, or not really anything that specific?
When I teach it, I do not. I just teach no more than a half a cup. And then I just say in the post-op, if you're ever eating fruit, you're always pairing it with your protein. I don't teach them too much.
I see.
Only because I don't want them to get overwhelmed, because I think that first 2 weeks they're so overwhelmed, with what they're trying to learn. So
too much regimen. Yeah, right.
So I just say, making sure you're pairing it and you're not chugging your juice.
Yeah.
It's interesting that you meant the thing about the apple juice and all that, because one of the hospitals that I do surgery at, they just started like this past year. I thought it was like a typo or something. They sent over their paperwork and they want the patients to drink a bottle of Powerade or Gatorade the morning of surgery, which, we're always told, don't drink anything that morning, nothing after midnight, that whole deal. Yeah. But I guess they've got some data on some studies that are showing, the issues with people being NPO for that long with the dehydration. NPO means nothing by mouth. So typically patients after midnight, they're told, don't eat or drink anything. And the reason for that is you want your stomach empty when you go under anesthesia, so you don't, vomit and then aspirate it into your lungs. So that's really important. But recently they've been promoting this kind of clear liquids drink in the morning, because I guess they're trying to get sugar back into patients right before surgery, because I think that, like Kylie's saying, that sort of prolonged fast is then leading to then the hyperglycemia and other issues after the surgery.
Is it 2 hours before? Do they give you a time and how much, or do you remember?
They tell them to drink it like right before they're on the way into the hospital, so it ends up probably being about 2 to 3 hours before they actually go under anesthesia.
Yeah, that surprises me. Yeah. But, I guess theoretically, the thinking is that the clear liquids will clear out of the stomach relatively quickly, hopefully. Hope you don't have anybody with gastric motility problems, but yeah.
Yeah. Kylie, with the fasting thing, so what about patients who are fasting on a regular basis as part of their, what they do? Do you just tell them, stop your fasting routines like 6 weeks before your surgery? Or?
Well, I think that how it affects your body is just more of an acute thing. So I say that week before. Like if they're fasting, like I know how that's popular, is that intermittent fasting. Is that sort of what you're talking about?
Or maybe more aggressive than that.
Yep, I do it myself.
Yeah, then, it's really dealing with more of acute. So I just say making sure that week before you're not fasting. And I really teach them, you have to pretend like you're going, like if you're a mom, you're about to go into 2 days of labor. Or if you're an athlete, you're about to run a marathon. So you have to think about, what would I be doing if I was about to run a marathon? Would I not drink? Would I not eat? No, you're going to nourish your body. So yeah, I tell them for the acute, just making sure that week before.
Yeah.
But it's more of how do we teach them so that they're compliant, right? That's what the big thing is. So it's like, we're going to tell you to do this, and this is why,
Yeah, that makes sense. Brian, speaking as a surgeon myself, we train in the practice of surgery and not so much in the nuances of nutrition. Do you think surgeons are answering all patients' nutrition questions or focusing out on how important the topic is? As surgeons, we only have a short time sometimes during the consultation, and, probably not a lot of it is spent on nutrition talk. And then perhaps regular office staff may not have the knowledge to educate the patients. So what are your thoughts about that? And do you think there should be a dedicated nutrition consultation for the patient, if it's feasible, and certainly if it's for a larger surgery?
Yeah, I seriously doubt many surgeons are spending any, if probably maybe a little bit of time. I guess it probably depends on the surgical specialty and the patient population and stuff. But In my field in plastics, I mean, I hear these horror stories of patients who, they're like, oh yeah, when I had my tummy tuck or whatever, the only time I ever met my surgeon was when they marked me that morning. Like I didn't see them for a consult. I never saw them post-op, which is absolutely crazy. I pride myself in seeing my patients for every single visit that they come in.
That's nice.
But even given that I spend all this time with them and that I'm an advocate for nutrition and think it's an important thing, I mean, I find myself having a hard time talking about it with every single patient. So I sort of cherry pick the ones that really, we need to have a good discussion on this about. So I definitely think there's a lag there, but I think also that's kind of a more global issue in terms of our healthcare system and just how we practice medicine in this country. Yeah. I mean, if you go to Europe, they use nutrition as a medicine, right? Or as a therapy. They use that to treat their patients, and their patients actually, follow their instructions and they do what they need to do. Versus here, it's kind of like, you got to check off that box that said, I spent 15 minutes counseling the patient on weight loss and nutrition sort of thing, just so you can get your...
you say you did it, yeah.
Say you did it and you can code it properly and all that kind of stuff. So I think there's definitely some sort of... There's a cultural issue too, and like Kylie said, it's one thing we can tell them all these things that they need to do, but are they actually going to go and do it, or are they just going to think we're blowing smoke?
Yeah. Well, that kind of touches a little bit on what I wanted to ask you guys next, each of you. What do patients want in a nutrition consultation or discussion? And what's been the response when you've taken the time to discuss the diet recommendations with them? Are they receptive, grateful, or, as you say, do they sometimes just ignore the, the advice? Or what do you guys think?
Well, our ends are probably a little different because when I'm seeing them, I'm just kind of introducing them to a lot of that stuff unless they already came in with a lot of that knowledge. But I think, the patients that Kylie's seeing are often, they're being either referred to her by me or another surgeon, or they've actively gone out there to try to investigate nutrition and make it more a pillar of their recovery process. So,
yeah. Kylie?
Yeah, first, I think that this is going to be one of the aspects of plastic surgery that's going to get bigger in the next, decade or so, because it's going to be patient driven. They're going to want more, just like the surgeons are trying to do more to meet what they're looking for. I'm passionate about making it click with the patient. Mm-hmm. Like, what will it take to make these patients compliant, right? And so when I went to Brian's office, I have these tear-off flyers. It's like 6 things to do. Do these 6 things. And it's quantifiable and it's specific. Because when we teach patients saying, hey, you need to eat more protein and eat some greens, they honestly, number one, they don't know what that means. And even if they do, it is
subjective, yeah.
It's their own thing, right? Like, it doesn't matter. They don't know exactly what to do with that information. So I just say, listen, my information is not perfect, but it's going to what is going to make it stick. So how do I make it stick? So it's infographics, it's simple things to do, it's quantifiable, and that's how we educate them. And that's what they want. They want specifics. Mm-hmm. So, for instance, I did a video that says the 2 best nuts for plastic surgery. Are they the 2 best nuts? Not necessarily, but they're my 2 great nuts that you can use after surgery. And so now I get people to say, I love pistachios, I love walnuts, I've been eating them because you've been telling me, right? And instead of saying a video that says, here's why nuts are good for you, right?
Yeah.
It's specifically telling them, how can I make this stick? And so that's what I'm passionate about, because that's how I learned too, right? So I don't want to get on the buddy trail, but
yeah,
my goal is to make it specific and easy and attainable.
It kind of takes out one step of worry from their whole regimen in the consideration of surgery, I would imagine. If you take a little bit of that decision-making burden off of them, they probably really appreciate that.
I think 99% of my clients have always said, I don't want to think, just tell me what to do.
Right.
And so I just say, okay, then do this,
Fair enough.
And then they can give choices afterwards, but we want to set them up for success. So yes.
Gosh, that's great. And then ideally, how far ahead should patients be considering their nutrition? How far ahead from the time of a surgery? How do you structure the timing of that?
For me, I ideally say it takes 3 to 6 months to replenish your deficiencies. The majority of us are nutrient deficient.
Oh.
So I say, if you are thinking about surgery, you are thinking about nutrition. You know, the minute you think about surgery is the minute you need to get on a multivitamin, hands down. So that's what I tell them. And then I say for surgery supplementation, like specific surgery supplementation, I say 3 to 4 weeks before surgery. Mm-hmm. But I say the minute you think about surgery, vitamins, supplements, and then for surgery supplements, 3 weeks before surgery.
That's nice advice. So how can you best set up a patient for success after surgery? Let's get into a few of the specifics. We've kind of talked about it a little bit, but what are some of the best food choices before surgery, maybe the week or two before surgery and after? Kylie, what do you think? And why are these particular choices good ones?
Well, I tell people there is some evidence for no nightshades. So no eggplants, tomatoes, potatoes. So I say none of that.
Sad. Those are great things.
I know.
And tell us why.
Because there's like this ingredient, it's not an ingredient, but it's a constituent in there that slows it down to detoxify out of your system. It's a small study out of Chicago, but it's been picked up by a lot of other surgeons. A lot of other surgeons practice that as well. And then the basics like ginger and garlic and all that too. That's for blood thinning.
Okay, so those can create some blood thinning, and we don't want that.
Yeah. But instead of telling people what not to do, I usually tell people, here's what you can do. And so we have a pre-op guide, and it's breakfast and lunches, and it's like what we sell in our meal guides. But basically, my 3 hopes for it are that you're getting a wide variety of proteins. So you're getting it from animal and plant sources, and that it teaches them to have at least 20 grams of protein at each meal.
Good guideline.
It's not high in saturated fat that's going to just stain your stomach. Like, you don't want to be constipated going into surgery. Like, you want your bowels moving, before surgery.
Right.
And then I had 2 cups of produce twice a day. So I recommend that not only for healthy gut bacteria, but also for the fiber, and then also getting the micronutrients right before surgery as well. Mm-hmm. So sometimes I just teach, it's not about the specific diet, it's about teaching you how to eat before surgery so that you're compliant after surgery, Mm-hmm.
And then are there differences between your recommendations before surgery and after surgery?
Yeah. Before surgery, I'm not really focused on higher calorie foods. Most of my meals before surgery are, between 300 and 400 calories. Mm-hmm. But then after surgery, I just make sure that we're not doing anything fat-free. We're not doing anything full fat, but we're just doing something that's like a low fat, making sure that nothing's diet, making sure that our meals are, ideally like, 600 calories a meal.
Ah, yeah.
So that's the thing.
Not restricting.
Yeah, we're not restricting, and we're increasing the calories and a little bit of the protein, but definitely the calories after surgery.
That's what they're going to need. Yeah.
And I also try to do like more of a dairy-free thing too. So I try to do like more of a coconut milk, and then teach them about soy and pea milk and things like that.
And why dairy-free?
Well, some of my patients are fine with it. I mean, most of them are. Like, they're totally fine. But sometimes just in that first week, sometimes it bothers them.
Can be a little irritating, yeah.
So sometimes I just say, okay, we're just not going to do, any dairy, any milk. Mm-hmm. So we just do a coconut milk or soy or a pea. Majority of my clients are fine with it, but that's how I teach it.
That makes good sense. Well, here's what everybody really wants to know. What are some of the worst foods to be eating before and after surgery, and why? And maybe pineapple juice goes in there, but you tell us what you think.
Yeah. So before surgery, be what I say. Like, so you're not having spaghetti, you're not you're not doing the huge pastas or lasagnas before surgery.
Not doing carb loading like if you're going for a marathon.
Well, I mean, that's where I see like you're carb loading through the juice at night, mm-hmm. and that's kind of my safety net. I don't really like saying like carb load before with the pasta, just because I don't know the research behind it, and sometimes they don't respond well, to that.
Mm-hmm. Yeah. So
avoiding the pastas and lasagnas. I keep it really simple. I like to say, if your surgeon allows, I always recommend fish tacos. Just because if they allow the omegas, the research shows that omegas help with immunity in the post-op. So we like to have like natural things like omegas to support the immunity going into surgery, and things to support immunity before surgery, like Brazil nuts as a snack.
Interesting.
And then just in general, you know, the smoothies and things like that. For the worst things, I would say you're just going to stay away from gas-forming foods before surgery. So you're going to stay away from the broccoli, cruciferous vegetables.
Cauliflower, Brussels sprouts.
Yep. The heavy meats as well. The beef and the lamb.
Oh, okay.
And then after surgery, what I say the worst foods are the foods that we've always been taught to eat. I say you're not doing saltines, you're not doing Jell-O, and you're not doing Campbell's soup.
Yeah, tell us more about that.
I get so much pushback on that.
I bet.
They're not bad. It's just that whatever you put into your mouth, it needs to be with a purpose and that you're nourishing your body.
Good philosophy.
You know, because your body is begging for nutrition. So when you feed it just a 5-calorie Jell-O, you know, and a 2,000 milligrams of sodium through a broth, chicken noodle soup, right? Like that's not going to help you feel better. So, so then I say, so we're going to avoid those 3 things. And then we're going to avoid saturated lamb and saturated beef. So I recommend a lot of ground turkey instead, because I like the arginine in it as well, which is an amino acid that you need in extra after surgery. So those 3 things, Jell-O, crackers, and canned soup. And then the best things that I like, you're drinking unsalted bone broth, you're drinking coconut water, and if you can front in your day with a high calorie, high protein smoothie right when you wake up, that's usually when you feel your best. Front in your day of having something like a 600 calorie, 40 gram protein smoothie in the morning, then that really can set you up for success for the rest of the day. Bone broth, coconut water, high-end smoothie, and I also like to say like a protein ball, and then also golden milk, which is like a pain-relieving anti-inflammatory drink that I like to recommend.
Those are some great specific recommendations.
Yeah.
I love that. Wonderful. Brian, are there some extra concerns for patients who have been on weight loss drugs like Ozempic? What special nutrition needs might they have, or what deficiencies might they have already?
Well, I think the big thing with any weight loss, but we definitely have been seeing it with patients on semaglutide and the other medications, is just a lot of loss of lean muscle mass. So, you know, they're losing a lot of weight, and thankfully a lot of that is extra body fat, but they're also losing a lot of lean muscle mass too. And, you know, that's where you see the Ozempic face and the Ozempic butt and all these other things that have like popped up because, you know, people are losing muscle mass, and oftentimes, you know, they're just going and getting a shot and they're not paying attention to their nutrition, because a lot of people think if I just take these shots every week that I'm going to lose weight. And they're right, a lot of them do, but I think that if you are more thoughtful about it, you can lose weight maybe more carefully, maybe not lose as much lean muscle mass if you're paying attention to your protein intake and things like that, lifting, strength training, like those kind of things. So I think that's a big thing. And, you know, lean muscle mass is important in the healing process. And that's the first thing that starts getting broken down after surgery, because you're in a catabolic state and your body is trying to repair itself. And what does it do? It starts eating away at your muscle to try to get protein. So I think that's a big thing. And then, you know, other things like skin laxity issues obviously become an issue, because a lot of times this weight loss can be a little bit faster than traditional. So when we see quick weight loss, we tend to see more skin laxity issues. And then that usually contributes to, you know, wound healing problems and stuff, because when the skin is kind of thin and stretched out, it doesn't hold sutures as well. It tends to fall apart more.
Yeah, it's a frustration when you're trying to make someone look good and you have those additional complications.
Yeah.
Kylie, I'm curious, when you do consultations for patients who have been on weight loss medication, do you have a special kind of program you like to put them on, or do you just say do a little bit more of what I've been telling you, what I've been talking about?
From my perspective, the GLP just jumped into the plastic surgery world like so fast for me. I don't know, Brian. I don't know about you, but all of a sudden you're hearing about it, and all of a sudden it's boom, it's everywhere and everyone's doing it. And so it just was just enormous. And as a dietitian, I was freaking out as a dietitian because I just thought there's no way these women are going to go into surgery on a GLP, not know what to do, and be able to recover. I was like, there's just no way. And so I reached out to this dietitian. She's been working with GLPs for 20 years, because they've been used for obesity and diabetics forever. So her and I created a GLP protocol for surgery and then a GLP protocol for weight loss. And it's just a digital download. It's one of my most proud assets that I have, but I made it for not only surgeons, but I made it for anyone because there was just no way they were understanding what to do. So just recently I had someone from New York City who said she knew lots about nutrition. She said that she's gaining weight because her doctor has taken her off her GLP and she has to hit 80 grams of protein. Well, that's because she didn't know how to eat enough food at high protein and stabilize. Just didn't know,
The right kind of food, yeah.
I think that's the thing, is having some type of resource or outsourcing it. That's why I created the digital download, but also just outsourcing to some dietitians who can help these women. Because there are dietitians popping up who have actually used GLPs and now they're coaching. I would highly recommend that for any surgeon. But for patients coming into it, I think it's the mindset piece of saying, we are no longer losing weight. You are focusing on healing. So I want you to set this aside because you can always lose weight, but you cannot come back from a poor surgery experience, right?
Poor healing, yeah.
Weight loss will always be there. It'll always, always be there. But right now, we're just focusing on stabilizing your weight and nourishing your body. So that's the biggest thing I try to teach. I just had that conversation like 2 days ago with a woman, and then really teaching them, some people don't talk about supplementation, but I say, I know that there's no way these women are eating enough micronutrients and there's no way. So getting on at least a multivitamin, because the majority of them are eating, 1,200 calories a day, and there's just no way they're getting enough nutrition.
Well, given that good advice, is there sometimes a role for nutritional advice that extends beyond the immediate post-operative period? In other words, can extended diet habits maximize their results over long term?
When I was doing my coaching, we wanted like this long-term coaching thing of teaching them sustainable habits, and it was going to be like this, year-long coaching. And I ended up not doing it because what I found was that you have to catch them let me take this back. Surgery helps them catapult them into eating healthy, because once they see their beautiful body, they're just like, I want to do whatever I can to maintain it. But really, that's where it goes back to when before surgery, I teach them, learn these 3 concepts. Learn protein at every meal, learn 25 milligrams of protein at every meal, understand what fiber can do for your body, and start walking every day, doing some resistance exercise, and that should be able to keep your results. Because surgeons can't do it, right? Surgeons don't have the time, or there's no reason they're coming back for them to the long term.
Right.
But that would be, I think, where you would hand them off to a nutrition coach or some sort of health professional who's just teaching about weight loss or weight management.
Kind of lifestyle, really.
Yeah. And now I teach, when I discovered Instagram and what nutritionists and health coaches were doing on Instagram, it's really a no-brainer. There's so many great ones out there who are having like memberships, accountability memberships, where they're trained professionals, they're not teaching anything crazy, and they are keeping them accountable, So that would be my recommendation.
Lovely. Anything to add, Bryden?
Yeah, I would say from a surgeon's point of view, it's super crucial that they maintain these diet habits, because oftentimes people come in, they think that plastic surgery is just a way to lose weight, right? I'll just get all this fat sucked off of me, or all this skin cut off, or whatever. And
it's
then
a panacea.
Exactly. But I tell them, if you continue with your current lifestyle trends after this, you will be back to see me, and you'll be spending more money and doing this all over again, except the next time it's going to be more difficult, challenging. The hope is, okay, now they see this result, I want to maintain it, I don't want this to go away, and maybe they make some changes. But I think we also just have to kind of take baby steps, because if we can focus on at least like educating people on good nutrition around the time of surgery, that maybe that eventually carries over to the long term. But I think if we just kind of go at them and say, listen, you need to be on this regimen for the next 2 years, they're just going to be like,
Not very well received.
What's going on here? This is too much information. So I think we can get them to at least focus on this immediate concern at hand, and then kind of, start from there. And I think, like she said, in the next probably 10 years or so, I think we'll see more improvement in the nutrition realm.
Yeah. I love that, Kelly. I think that's just, that's exciting to hear. And you have your kind of ear to the ground a little more, certainly, than I do. So I think that's just great. Do either of you have a story about a particular patient where nutrition was a concern for you and really made a difference in their outcome?
I think two. My very first client was a breast cancer client. She'd probably had 5 surgeries with me. Wow. And to see someone who had cancer and go through all these surgeries, some were cosmetic, some were for her cancer, and to be able to see how nutrition does play a point, because that is also a realm that women are not taught about nutrition during their surgery, is the breast reconstruction space. So I'm hoping that that's a space that women can get into to start teaching education about nutrition. And she's actually been my biggest advocate. Now she tells everybody about it, but she actually got me into the breast cancer space.
Oh, great.
She understood that nutrition during cancer is just as important. And it's not cancer nutrition, it's surgery nutrition, for the cancer, right? That's 2 different things. So
that's important to distinguish that.
Yeah. And then I think the second biggest thing are bariatric patients who had horrible experiences with round 1 of cosmetics because they just weren't doing it right.
So after massive weight loss.
Skin. And then just really honing in on their nutrition and really seeing the differences between the two, of just using nutrition. Their incision looks different. This one got back to me last week and she said, the difference between just drinking the apple juice the night before surgery and how I felt the post-op is completely different. And she had 4 major procedures. So just little things like that, not just how you're looking, but literally how you're feeling because of just what nutrition will do for you.
Dr. Arslanian, anything for you?
Yeah, it's funny you said that, because I was actually going to say that I don't have a specific story, but I would say that just my experience working with a lot of breast cancer patients, it's a combination. They've got cancer. Oftentimes they're going through chemo, radiation. They're stressed beyond belief.
Impacting their bodies negatively.
There's a lot of negative factors going on, but we definitely see in that patient population that complication rates are, I don't want to say they're super high, but compared to the cosmetic surgery population that we deal with, it's considerably higher. And I would definitely say there's significant nutritional issues that are contributing to that. And I think that you can kind of extrapolate that into the cosmetic surgery world, where we might be dealing with, less severe complications and maybe not as frequently. But I think you can definitely extrapolate that, because I've seen patients, breast cancer patients, who they really focus on nutrition, and they're really focused on a lot of aspects of their care. Sure. And they oftentimes, they got a bad cancer and a tough surgery ahead of them and stuff, and they do way better than you expect. And then you have other people that could care less about their nutrition, and they just get a really poor outcome. So
focus on nutrition can really be key.
Yeah.
Well, as we wrap up, do either of you have any lasting thoughts you'd like to leave the listeners with about our subject today, the importance of perioperative nutrition?
This genius woman on my team, she was incredibly talented, but she created this saying that said, equity for elective surgery. And I just love it. And it was we need to consider and treat elective surgery as serious as any other surgery. Women and men undergoing any cosmetic surgery deserve serious attention in their nutrition. So I just tell people, you deserve you deserve hospital level nutrition for your surgery.
Yeah.
I would agree with you on that. I think too many people come in thinking this is just cosmetic surgery and it's not going to be a big deal. And that's one of the big things I do. And I probably lose a lot of patients doing this, but I'm pretty straightforward with them, telling them this is going to be a big surgery for you. This is what the recovery is going to be like and everything.
Don't take it lightly.
Exactly. And if they're going to sign up for surgery after I've told them all that, then I know that they're probably ready. versus just kind of tiptoeing around, oh, you're going to be fine, everything's going to be great, and then the day after surgery, they want to kill me. So,
oh, goodness. Oh, gosh. Well, I tell you, you guys have been wonderful today. You have shared such important information with the listeners and given us such insightful things to remember. Really appreciate that. Kylie Bensley, registered dietitian. Tell us the name of your website. So if people want to find out about those 6 things that you recommend, those specifics, what would they do?
It's sulinu.com. So SULINU.com.
Perfect.
And on Instagram, I'm sulinu.nutrition.
Great. And then Dr. Brian Arslanian, thank you so much for sharing your insight from Atlanta. And your website, I believe, is arslanianplasticsurgery.com. Is that correct?
That's correct. You got it.
Okay, great. Well, thanks, you guys.
Thank you.
And we're going to go off into the world of good nutrition as we part.
Yeah.
Okay. Thank you.
Thank you so much. I appreciate it.
All right. Take care. Well, that's our show for today. Hope you enjoyed it and learned something too. Don't forget to subscribe, rate, and review. Please share this podcast with someone else who might be interested. And while you're at it, check out the podcast website for related topics to explore. It's www.plasticsurgerydecoded.com. And as always, thank you for listening to Plastic Surgery Decoded.